Hello everyone, my name is Jaideep Sandhu. Today I'm going to present PowerPoint slides on outbreak investigation of Chikungunya virus disease in India. I will start with agent. Chikungunya virus is an unwell positive strand RNA virus. It belongs to alpha virus genus. The vector, the disease is spread by Culex mosquito in general and Aedes in particular. It's a day biter diurnal vector with peak of activities at the end of the day. The disease is transmitted through the bite of infected mosquito. Mosquito become infected when they feed on person already infected with virus. Common reservoirs are monkey and other vertebrates. In epidemic period, men also act as a reservoir for Chikungunya virus disease. Clinical trials, fever, rashes, and arthralgia suggest Chikungunya virus disease. Other symptoms may include headache, muscle pain, and joint swelling. Usually self-limiting. In rare cases, complication can occur: fulminant hepatitis, myocarditis, and pericarditis. Individuals who are at elevated risk are in newborn, older adults, and people with medical conditions such as diabetes and heart disease. This is a bar chart showing fever and joint pain as the most common symptoms. Geographical distribution. Chikungunya virus outbreak has been identified in Asia, Africa, Europe, and the Indian and Pacific Ocean. In the year 2013, first local transmission of Chikungunya virus was identified in America. Since then, local transmission has been identified in 45 countries throughout America with estimated 1.7 million suspected cases. Since 2005, Thailand, Indonesia, India, Maldives, Myanmar have also reported over 1.9 million cases. Outbreak of Chikungunya virus in India. Historical data indicate outbreaks during 1964-1965 and more than 300,000 people were affected. Before 2005, the virus was last reported in year 1973. Chikungunya virus had almost disappeared from India after 1973. No cases were reported till 2005. And in 2005-2006 outbreak, approximately 100,000 cases of Chikungunya virus were reported in India. This is a bar chart showing acute increase in incidence of Chikungunya virus disease. This is a table showing different states with suspected Chikungunya fever cases. This is a visual showing Maharashtra and Karnataka who got the massive hit. Steps I would take to conduct investigation for Chikungunya virus outbreak. The first thing I would do is I would identify investigation team and resources. The team include epidemiologist, subject matter expert, disease investigation specialist. I would also include the National Institute of Communicable Disease and Institute of Virology. The second thing is I would do is establish the existence of an outbreak, increase in cases above what is expected. Chikungunya has had almost disappeared from India after 1973 and no cases were reported in 2005. In 2005, certainly the hospital were flooded with patients complaining fever and joint pain. Until August 2006, total number of suspected cases were 100,000. This signifies the outbreak of Chikungunya virus disease. The third thing is I would do is verify the diagnosis by obtaining medical records and lab reports. I would also request a reverse transcripted and IgM ELISA to confirm the diagnosis. And then the fourth thing, I would construct the case definition. The component of case definition are person, place, and time. In case of Chikungunya virus, the person can be acute illness with fever, rash, and arthralgia. Time frame can be December 2005 and August 2006. And fifth is find cases system and develop line lists. Line lists includes clinical information, onset time, symptoms, demographic information, exposure information. And sixth is perform descriptive epidemiology and develop hypothesis by collecting patient data and then reviewing and plotting on epidemic curve. We can generate hypotheses about cause and source of outbreak and then evaluate hypothesis by through analytic epidemiological study. I would prefer case control study because it is less time consuming and cheap. And based on the information gathered information, we will implement control measure for Chikungunya virus disease, such as protective clothing, insect repellents, and then we will communicate the findings to inform public and media. And the last thing we will do is maintain surveillance to decide if the outbreak is over. And these are the reference. Thank you for watching this video.